Hello, everyone. How are you? My name is Deontay Marquis, and I will be presenting to you the topic of heart disease, specifically medications, treatments, and nursing care on behalf of my ALF training for the next hour. You guys and gals will be with me. So let's begin our lesson for today. Um, First, as always, I like to begin with some course objectives. Today, there are 5 course objectives, and the course objectives are exactly that. They are the things that we will be discussing, laid out in detail so you can see and be aware of the topics we're covering today. And then at the end of the presentation, I like to review those course objectives with you just to highlight again from the presentation the information that you got that answers each of these statements. So, first course objectives for today. By the end of today's presentation, you should be able to define heart disease and discuss its impact on the health in the United States. Second course objective, you should be able to identify the most common types of heart disease, specifically coronary artery disease, arrhythmia, and congestive heart failure. Those are the 3 most common. And I want you to be able to discuss signs and symptoms of each of those types of heart disease by the end of this presentation. And third course objective for today, you should be able to understand risk factors associated with each type of heart disease and the appropriate preventative measures to reduce risk of those types of disease. Moving along, our fourth course objective for today, by the end of the presentation, you should be able to discuss common medications patients with heart disease may be prescribed, the side effects of those medications, and we'll also discuss nursing considerations for taking care of patients who are taking these specific types of medications. And of course, our last course objective for today will be at the end of this course, you should be able to discuss key elements of the physical assessment specific to patients with heart disease and paying attention to any abnormal findings. So, we're going to talk about what are these abnormal findings that may indicate a medical emergency has begun or is about to begin or seems to be approaching our patient within the next hour or so immediate time. So we're going to talk about all of those things today. And at the end, there will be a 2-question quiz. But I will give you all of the answers to the quiz throughout this presentation as long as you pay close attention. Okay, now let's begin. First, the most important thing, which you're maybe asking yourself, or if you already feel like you know what heart disease is, you may be telling this to yourself. What is heart disease? So, I want to define heart disease today as uh, a term that is used to describe a varying number of diseases, and these diseases all relate to the heart. And as I stated in our objectives today, the most common or prevalent of these diseases is or would be coronary artery disease, arrhythmias, and congestive heart failure. Now, heart disease is the leading cause of death in the US among men and women alike. Heart disease is a disease that claims a life every 36 seconds in the United States. So, every 36 seconds that passes, that is unfortunately another person we have lost due to heart disease. Now, here I just want to make sure that everyone understands the importance, or should I say, impact of heart disease in the US, where we are living today. So, as you can see, our first graph or picture here, above it, I've written heart disease costs the US $219 billion each year from 2014 to 2015. Now, you can only imagine this was 5 years ago, as this presentation was recorded in 2020. So, 5 years ago, 219 billion. And since then, heart disease is still one of the leading causes of death in the US, and that number continues to grow. So we can only imagine how the number here, 219 billion, continues to grow when every $1 in $6 spent on healthcare is spent on cardiovascular disease. So, what I'm trying to say here is cardiovascular disease is on the rise, and the cost 5 years ago was this staggering figure of 219 billion. So we can only imagine how that number has increased over the last 5 years, alongside the number of US dollars spent on cardiovascular disease and healthcare. Um, and this middle graph or picture here, it shows you an estimate of those figures spent on heart attacks, which is, as we will discuss today, a sequelae of heart disease. It is one of the signs and symptoms, or one of the big health concerns that occurs as a result of cardiovascular disease. So, specifically, I want you guys to look at where it says cardiovascular disease total costs are expected to reach 1.1 trillion in 2035. So, from 2014 to 2035, over the course of 20 years, they don't anticipate heart disease to decrease. They don't anticipate cardiovascular disease to decrease. And they certainly don't anticipate heart attacks or the amount of money needed to spend to treat patients who are having heart attacks to decrease either, which is why we are having this presentation today. And I'm trying to impart the importance of this information we're going to go through today by pointing out its impact on the US and how professionals in the healthcare system do not anticipate um, these healthcare needs or costs to decrease anytime soon. And last but not least, the number of heart attacks every year, 805,000 is the estimated. So 805,000. Let's say every person that had a heart attack stayed in the hospital for about 3 days. That's 2.4 million days patients or Americans are staying in the hospital due to heart attack, which is something that we can prevent or at least manage better. So these patients are needing this care. And we're going to talk about how to do that today. So, what is the cause of heart disease? We've talked about how important it is, and now you want to know what causes it because you are empowered to try to prevent it now after we talked about those staggering figures. So, what are some causes of heart disease? What are the things that we should be looking for to put a stop to, or to tell the patient, hey, you shouldn't do that, or you should do this? What are those things? Well, the biggest risk to half of Americans is that they have heart disease. And heart disease is uh, conversely, not conversely, it's related directly to high blood pressure, to high cholesterol, and smoking. So those are the three things that we want to educate our patients about, and identify as risk factors for our patient to cite them as a person who we should focus our care on. And that would be patients who have high blood pressure, patients who have high cholesterol, and patients who smoke. So risk factors, just in general, include, so these aren't the key risk factors, as are high blood pressure, high cholesterol, and smoking. These are just the more general common risk factors that people may have. And they are patients with diabetes, obesity, high blood pressure, high cholesterol, who smoke, who are physically inactive, um, hereditary. So patients develop heart disease because it is indeed hereditary. And yes, I said, if you remember a few slides ago, that heart disease affects both men and women, but it does have show a preference for males. So, types of heart disease. So we've talked about the three key risk factors, and we've talked about the risk factors in general. So now we need to talk about the three types of heart disease, because heart disease, on our first slide, as we talked about, is just an umbrella term used to define a group of diseases. And the most common of those diseases are the three that we're going to talk about now. So, um, coronary artery disease is one of those diseases that falls under that umbrella term of heart disease. And coronary artery disease is the most common type of heart disease that we see here in the US. Now, what causes it? Well, great question. Plaque. As you can see in this pictograph here, plaque has built up inside the blood vessels, slowing or completely occluding blood flow down the vessel to the heart, and that's a huge concern of heart disease. Plaque buildup causes our arteries or vessels to narrow over time, and it only continues to get worse as the patient keeps smoking or continues to be obese, and all of those risk factors that we talked about continue. So, what are some signs and symptoms that someone may be suffering from heart disease? Then what might they complain about? Well, angina is certainly one of the most common, one of the most biggest, and one of the most alarming warning signs of coronary artery disease. So we talked about how plaque builds up inside the arteries, it causes them to narrow, and because of that, blood doesn't flow properly or is completely uh, impeded. Well, uh, this leads to angina because the blood carries oxygen, and when oxygen doesn't reach the muscle that it's intended to, and the heart is a muscle, then that muscle that isn't getting the oxygen, so it becomes angry and it causes us pain. So, angina is the biggest sign and symptom of a patient suffering from coronary artery disease. Also, weakness, lightheadedness, short of breath, and shoulder pain and arm pain or discomfort. Those are two of the leading signs and symptoms as well associated with coronary artery disease. And this also leads to heart attack. Congestive heart failure is the second type of heart disease that is the most common in today's society. So, congestive heart failure, what is that? It sounds terrible. Sounds terrible. That's because it is. It's a chronic and progressive condition in which the heart is unable to pump enough blood to meet the body's needs. So, simply put, the heart can't keep up. It's being demanded of too much and it just cannot keep up. So, I have a picture here because that description may not illustrate to you what it's supposed to or what exactly congestive heart failure is. So, you'll see here the normal heart muscle, how the walls are not very thick, and then the congestive heart failure, the walls are thick because they can't do what they need to do because uh, they're not able to pump properly. And we'll talk about why. But they're not able to pump properly, so they're not getting the right oxygen and nutrients back. And in an effort to try and pump properly, they're pumping harder and harder, and so the muscle swells, just like a muscle in your arm when you go to the gym. The muscle swells, and then it actually has an inverse effect. If you go to the gym and you pump your arm lifting heavy weight, your arm will eventually get bigger and you'll be stronger. But in congestive heart failure or with the heart muscle, it's pumping, it's pumping, it's pumping. It's not getting stronger, it's only getting bigger. So it's actually able to do less. Now, congestive heart failure. Most people who develop heart failure have a pre existing heart condition. The most common conditions that can lead to heart failure are coronary artery disease, high blood pressure, or the patient having a previous heart attack. that is one of the leading pre-existing conditions that can actually lead to a patient developing congestive heart failure. So if you get a patient and the patient comes in and they tell you, or you see on their chart that they've had a heart attack before, just know that they are one of your congestive heart failure patients. They are at extreme risk of developing the signs and symptoms here. And this is because their heart is very weak, as I talked about the muscle scenario and lifting weights with your arm muscle. So signs and symptoms, they're going to be more fatigue. They're going to be prone to develop shortness of breath. So they're going to be activity intolerant. It's going to be a little difficult to get them involved in daily activities. And they're also going to have edema or fluid in the lower extremities. And now those are the external signs that we can see. The internal signs that we can't see that's going to be going on with this patient who has congestive heart failure. And we talked about how their heart is going to be enlarged and have an increased muscle mass, but this increased muscle mass doesn't directly relate to the ability of the heart to actually pump blood. So that's another internal sign that's causing these external symptoms we talked about. And also, the heart is going to pump faster to compensate its inability to pump efficiently. So, this patient is going to have a more elevated heart rate. And when you do get them to finally participate in some physical activity, you really want to take note of their heart rate because it's going to be like most likely is to increase. And also, you're going to want to watch their oxygen saturation because they're going to be short of breath for a longer period of time because they're so unable to pump oxygen and blood to the body. So these patients we want to look out for. And last but not least, of the three main types of heart disease we're going to talk about today, arrhythmias. So patients with arrhythmias. And what is an arrhythmia? Arrhythmia, when you look at the heart rate monitor and you see that the lines just don't quite look right, that's an arrhythmia. And that is a change from the normal sequence of electrical impulses that the heart sends to each individual chamber to conduct an appropriate musical symphony or it's sending the right electrical currents so that the heart beats perfectly in each four chamber and they're beaten together and it's beautiful. An arrhythmia is everything except that. And this can be something that's either harmless or life threatening for a patient. Now, some of arrhythmias that you may find are brief, while others last a long time and they can cause the patient's heart rate to be too slow or too fast all day, a couple of hours, or maybe for the next week or 3 days. And then sometimes the patient may have an arrhythmia that lasts 10 seconds. So you just don't know what you're going to get with the heart. But because the patient has this arrhythmia, the heart pumps less effectively than it should. Um, so atrial fibrillation or AFib, as you may have heard, is the most common cause of arrhythmia. Now, so let's just get that ladder in line. AFib is the most common cause of arrhythmia, and an arrhythmia is one of the three most common causes of heart disease. So we're just getting our ladder in order. Didn't want you guys to get confused. So atrial fibrillation is the most common arrhythmia, and when you have AFib, an abnormal electrical signal keeps the heart's chambers from pumping in sync. So we talked about on the last slide how each of the heart's four chambers sends electrical impulses, and they all beat perfectly. And it's like a perfect musical symphony. Well, inside the heart, when you have AFib, an abnormal signal keeps the heart chambers from pumping in sync. So you really want to look out for these patients by checking their heart rate, whether it's with on their chest or their wrist, checking their heart rate on the monitor, and just feeling for any abnormalities in the way that the heart beats. Now, signs and symptoms that a patient has an arrhythmia or they are in their arrhythmia, because sometimes patients have arrhythmia, but they're never in it, or it's so short that the patient isn't sure, or maybe the patient just isn't sure at all and they don't report it. but what signs and symptoms can we look for that will clue us in that this patient is having their arrhythmia? Well, those signs and symptoms include if the patient is complaining of fatigue or weakness. Maybe they're saying that they're dizzy or lightheaded. They're feeling faint or feel like they're having faint spells, or they're having a rapid heartbeat, shortness of breath, anxiety, chest pain. So it kind of seems like a lot of different symptoms. But one of the most common for patients is shortness of breath or anxiety, and they may feel a rapid heartbeat. If they do stand up, they do report dizziness or lightheadedness. But in my experience, and I've cared for a lot of patients who have AFib, both older and younger, one of the most common symptoms is shortness of breath and anxiety. So the patient develops this anxiety because they feel like they can't breathe. So, of course, that would make anybody anxious. So that, in my opinion, is one of the most common. But you want to talk to your patient. You want to ask your patient, are they aware how their arrhythmia affects them? And most scenarios, the patient is very aware of how their arrhythmia affects them. And they can tell you, I have shortness of breath. I feel dizzy when I stand up, or I feel a funny feeling in my chest. And all of those symptoms you should write down, keep some type of log for. So when the patient complains of those symptoms, or seems to be experiencing those symptoms, you can be alert to that they're having their arrhythmia and not stand them up or help them find their seat until that arrhythmia passes or that particular sign or symptom. So, so I put this here again just to show you guys the risk factors. Uh, And just to clue in again on the key risk factors for heart disease, and heart disease includes all three of those diseases that we just talked about. And just a refresher, we talked about coronary artery disease and the buildup of plaque. We talked about congestive heart failure, and we also talked about arrhythmias. So, the risk factors for heart disease, what those three diseases make up, include high blood pressure, high cholesterol, and smoking. So, risk factors and preventative measures. So, here you'll see I have those three diseases that we just talked about: coronary artery disease, congestive heart failure, and arrhythmia. And I have risk and repair. Now, I put risk because I wanted to kind of narrow or hone in on the specific risk factors for each disease. Although some of those risk factors are the same across each disease, there are some that are more specific. So I wanted to try and get as specific as I can. Even though these are three types of heart diseases, I still want to draw distinction to each. So, risk for coronary artery disease: patient is overweight, physically inactive, not following a good diet, smoking tobacco. These are our risk factors for CAD. Now, to repair a patient with coronary artery disease, um, our goal is to lower their risk of having heart attack or a more serious disease occur as a result of their heart disease, their coronary artery disease. So how can we do this? We can do this if they're having a bad diet, if they're not following the proper diet. We can introduce them to a low sodium, low fat diet, perhaps the DASH diet or the heart healthy diet. Also, if they are physically inactive, we want to increase their physical activity. And I'll talk about specifically what types of activity we should suggest and for what duration we should also suggest. So, uh, to reduce their risk of having a heart attack as a result of coronary artery disease, and remember, coronary artery disease is the plaque is thinning the diameter of the vessel, so blood and oxygen are unable to flow freely as they should to parts of the body and also the heart. So we want to lower the sodium. We want to introduce them to a low fat diet. We want to increase their physical activity. We also want them to find and maintain a new healthy weight. So we want to set a goal that we want to help the patient work for and work towards, and also check off milestones as they work towards that number, and uh, give them those little stepping stones. So when they finally reach that healthy weight, we can rest assured, and we can let them rest assured that they have indeed lowered their risk of having a heart attack, and congratulate them on the wonderful accomplishment and the move towards improved health, specifically lowering their coronary artery disease risk for a more serious occurrence. And also, if they're smoking, absolutely not. We have to stop them from smoking, requesting from the doctor some type of nicotine patch. So, moving on to congestive heart failure, what are some of the risks for a patient with congestive heart failure? And remember, this is the disease that we talked about, is unable to pump oxygen and blood. And the heart tries to compensate by beating faster or beating harder. And regardless of its efforts, it can't. And actually, by it trying to work even harder, it makes the disease actually worse, and the muscles of the heart actually thicken, which is against what we want. So, um, what are some risks for patients who have congestive heart failure? Well, a patient who has congestive heart failure, they most likely have coronary artery disease already. And the key risk factors that we talked about for a patient to develop heart disease just in general, one of them would include high blood pressure. And also, this is the patient who most likely has had a previous heart attack. So this is a patient who, if they have congestive heart failure, sorry, this is going to be our patient who has been struggling to lose the weight, to change their diet, to stop smoking, to reduce their risk factors, because they most commonly already have coronary artery disease, and they haven't been following the doctor's advice per se, or maybe they have some other type of medical condition that's making it very difficult for them to follow the doctor's advice and reduce their risk. So now their heart um, isn't getting the blood properly, and it has developed congestive heart failure. Now, this disease, once they've progressed to their heart health has progressed to congestive heart failure, uh, worsen to congestive heart failure, I'm sorry, this can't be repaired. It can't be cured. But all we can do here is treat the patient. So we still need to reduce their risk also of having another heart attack. So we want to push the importance of diet modifications, physical activity, unhealthy living, unhealthy eating. We want to still push it, and we need to push it even more for this patient. Um, and also weight management. We may need to get a specialist or have them evaluated by a psychologist. Maybe they're going through some type of depression, or something mentally is holding them back, or psychologically is holding them back from reaching this goal. And we need to just encourage them to do it. Uh, Last but not least, under our heart disease, arrhythmia. So, a risk for arrhythmia, these patients have narrowed heart arteries. It's something that they may be born with, but most likely they've developed over some time. A risk is the patient who's had a heart attack. By the heart having a heart attack, it puts them at risk for having an arrhythmia, because the heart stopped or paused its beating because of that trauma to the heart. And as a result, the electrical impulses we talked about in each chamber, sometimes they get thrown off. Maybe this patient has had some type of heart surgery, or has heart failure. So when the heart is unable to beat properly, it could cause an arrhythmia. And we discussed thoroughly what an arrhythmia was, so I hope you have some understanding of it now. But let's get into a bit about how we can repair this arrhythmia. We talked about how sometimes it is serious and sometimes it isn't, but we want to limit the amount of time that a patient's heart is in an arrhythmia, because uh, this can also be uncomfortable for the patient. So how can we do this? We want to limit substances that can cause or contribute to the heart not beating correctly. And you and I have probably felt it. Coffee is one of the leading substances that could contribute to this. Of course, illicit drugs, herbal teas as well, caffeine drinks. Just we want to really lower or stop our caffeine intake for these patients. Reducing their high blood pressure, controlling cholesterol, of course, weight management. We want to get them on a weight management plan. We want to change their diet, and we want them to stop smoking. So those are the risk and repairs for arrhythmia, congestive heart failure, and coronary artery disease. The more specific risk, I wanted to, as I said, point them out to you guys, and then also get into the repair for each one on what type of management and what type of care you can be expecting to give this patient. So now you may be asking yourself, well, how can I help? How can I help change this person's life and help them get healthy? And it begins with lifestyle modifications. I call the care for this patient with heart disease the three C's, because we're caring, caring, caring. No, no, no. We do care, but in order for us to show the patient how much we care for them, we need to help control their weight, control their cholesterol, and control blood pressure. So we just want to tell the patient we want to put them back in control of their lives. And they can do this by controlling their weight, controlling their cholesterol, and controlling their blood pressure. And it's going to take a lot of work, but the first step for the patient is going to be the diet changes. And this is going to have a significant impact on their health moving forward. And the DASH diet is most recommended because we want to control their blood pressure. So in order to control the blood pressure, we need to reduce the sodium intake. And that's exactly what the DASH diet does. It looks to significantly reduce sodium intake while getting the patient to eat different varieties of food that are rich in other nutrients that will also help lower blood pressure. So the DASH diet is looking to just naturally decrease the bad stuff and increase the good stuff. And the good stuff would be potassium, calcium, magnesium, foods that are high in those areas. So there's a website here that I linked. I want to take you guys to, and this website is just going to show us about the DASH diet, specifically what types of foods we can expect for this to be given this patient and how much, because that's the biggest thing, right? Okay, I can eat this type of food, but how much do you want me to eat and how often? Well, I don't really like the name Dash Diet because diet always implies something that's short term. And the Dash Diet isn't a short term fix for these patients, it's a long term fix. So we want to call it the Dash way of eating. So, um, in the DASH diet, the patient and you can expect to be giving the patient 6 to 8 servings per day of grains. So that's exciting. They get a lot of food, a lot of grains, 6 to 8 servings a day. Um, an example of one serving would be one slice of whole wheat bread, 1 ounce of dry cereal, or half a cup of cooked cereal, rice, or pasta. My patient, I would prefer to start them out cereal in the morning, whole wheat bread if they would like some, maybe a slice with dinner. But other than that, rice. Rice for me would be the best option. But they tell us here, as you can read, focus on whole grains because they have more fiber and nutrients than do refined grains. So, for instance, use brown rice. Oh, just as I said. Hmm, how did I know? Well, uh, you can visit this website if you'd like. It's at the Mayo Clinic. Um, and again, we are not associated with them in any way, just giving you guys a good reference. So we can expect to offer our patient grains, vegetables, fruits, dairy. I want to show you guys what it says about dairy. One serving includes 1 cup or skim milk or 1 of percent milk or 1 cup of low-fat yogurt, and this is only 2 to 3 times a day, and preferably low-fat or fat-free frozen yogurt. So not full fat, we want to make sure it's low-fat or fat-free. The patient's also going to be having some lean meat, poultry, and or fish, nuts, seeds, and legumes, fat and oils. So if you'll see here, it's just really getting the patient to eat more whole foods, and as exactly as the diet states, a wider variety of foods. Now, the patient may be most inquiring about this section of the diet, our sweets, 5 servings or fewer a week. 5 servings or fewer. And it's only going to be sweets such as jelly or jam with their bread, with their whole grain toast. Only 1 tablespoon of sugar, jelly, or jam. So if they want sugar in their coffee and in their jelly or jam, you're going to have to cut that tablespoon in half because it's only 1 serving or fewer a week. So it's just learning how to teaching them how to live and how to recognize the amount of sugar and servings they should have versus the amount that they are having, which is not recommended for them anymore. So we talked about the DASH diet. Now let's talk about exercise. You see here, diet, exercise, and medications. Those are the key to controlling the weight, controlling the cholesterol, and controlling the blood pressure of the patient. So exercise, our patient can do aerobic exercises, walking, cycling, swimming, dancing, 30 minutes duration, 3 to 5 times a week. 3 to 5 times a week. They can do more, but they can't do any less, and they can do any of those activities. So we want to encourage our patients to contribute to participate in some type of aerobic exercise 3 to 5 times a week. If the patient has a little bit more tolerance, we can introduce them into HIIT, high intensity interval training, which is just having them exercise, do something very intense for a minute, and then recover by just doing that same activity lightly or a different activity lightly. And also strength training 2 days a week. And you can also do strength training when you do aerobic exercises with the patient, of course, if they are up for it, if they are able. But we want to make sure that we are pushing them, but still learning their limits and not overexerting our patients, because this is a way of life and not just a short-term fix for them. So this is something that they need to be able to do every day. Now, on just previously, we talked about diet, the DASH diet. We talked about exercise, different type of exercises. And now we're going to talk about the medications. So, oh, whoops. Let's find our slide here. Yes, here it is. So we talked about heart disease, causes of heart disease, risk factors. Let's talk about our medications. Okay. So, medications, we want to talk about side effects and specific nursing considerations um, of these medications. So when patients take medications, we know that there are always different side effects that come with those medications. So what are the nursing considerations with the side effects associated with the medications we're giving our patients who are suffering from heart disease, whether it's coronary artery, congestive heart failure, or arrhythmia? So coronary artery disease, these type of patients are going to be taking most commonly aspirin, some type of ACE inhibitor, statin, beta blocker, and nitroglycerin. Now, what are these medications used for? These medications are used to control cholesterol and help control blood pressure, which are two of the key risks for patients who develop heart disease. Now, nitroglycerin is the only medication that isn't doing one of those two things. Instead, nitroglycerin is given when a patient has a significant amount of chest pain or angina. We can give them nitroglycerin. And side effects of nitroglycerin include headache, dizziness, lightheadedness, nausea, and flushing. But headache is a sign that it's working, that it's doing what it's supposed to do, and that should not be treated. It should only be noted at the time that the headache begin, and that's a sign again that nitroglycerin is working. But it is a side effect. Um, Now, if a patient has been given nitroglycerin or takes nitroglycerin every day to prevent angina or something else that the doctor may have prescribed it for, um, we should be on alert to reduce the risk of fall because of the patient's dizziness. So if this patient's taking nitroglycerin, we want to make sure that they are seated and they stay seated and they get up slowly when rising from a sitting or a lying position to a standing position. So patients who take nitroglycerin have some type of coronary artery disease, and the most noted drug that they're taking is nitroglycerin, and this can cause headache as a side effect. But a headache lets us know that it's working. The biggest nursing consideration for this patient taking this medication is fall because of the changes in blood pressure that are caused immediately as a result of nitroglycerin. Now, this patient is taking other blood pressure medications, but I'll talk about those in general because the patients across the board in the heart disease category are trying to control their blood pressure. But specific to coronary artery disease, nitroglycerin, headache is a sign that it's working, and reduce the risk of fall. Now, congestive heart failure. This patient is taking ACE inhibitors, which our patient on the coronary artery disease is also taking, beta blockers, our patient here is also taking, and diuretics. This is new, as well as anticoagulants, which I have asterisk because patients who have AFib also take that medication. So I'm going to talk about anticoagulants as it applies to both congestive heart failure and patients with arrhythmia because there are a lot of nursing considerations associated with anticoagulants. So, anticoagulants are also called, or more commonly called, blood thinners. And that is because bleeding is the biggest concern for a nurse or a patient or medical staff member when a patient is taking some type of blood thinner. Now, what should you know if your patient is taking a blood thinner? Well, you should definitely know that they should not be drinking herbal tea. Why? Because herbal tea, as well as leafy greens, can affect the effectiveness of vitamin K. And vitamin K acts directly, it changes the effectiveness of the drug due to the vitamin K that are in herbal tea or leafy greens. Okay. Now, this applies to certain blood thinners that the patient takes. Some blood thinners that the doctor may prescribe for your patient, whether it's one brand or another brand, vitamin K and its association with leafy greens and herbal teas isn't important. But we don't know which blood thinner your patient may be taking. So you need to ask the doctor or the nurse or look it up and find out if the blood thinner medication your patient is taking affects vitamin K and therefore has some impact on the effectiveness of the blood thinner that they're taking. And this will let you know whether you need to closely monitor their diet, educate them, and make sure that they aren't eating too much leafy greens or herbal tea, or if this is something that you don't need to be so concerned about. Now, what are some other nursing considerations for patients who are taking blood thinners? Well, we want to make sure that we're noting their skin. Any skin breakdown, any old skin breakdown, um, we want to make sure that we're monitoring it, we're treating it appropriately because it can the patient is taking a blood thinner, they're at risk for bleeding. So any small insult to the skin integrity can lead to bleeding issues, whether it's a small cut or they scraped their leg getting out of bed. You can tape it up, and then because they're on a blood thinner, it's going to bleed a lot more than normal, and you're going to need to hold pressure. You're going to need to do everything twice as prudent to make sure that bleeding doesn't consistently occur or small oozing amounts consistently. Okay. Also, brushing the teeth. We want to make sure that brushing and flossing, we're giving special consideration that this patient is taking some type of blood thinner. So we're just being a little more gentle, not as rough. We want to make sure that if it's a male patient, that we ask them, do they shave? Because if they shave every day with a razor, then we need to give them an electric razor or a certified safeguard razor that won't allow them to cut themselves, because even a small cut or tear while they are shaving can form itself into a bigger incident because this patient is on a blood thinner. Also, we need to make sure that this patient, they're getting blood tests, because routine blood tests is going to cue the doctor in on how to titrate this medication, if it's working too well or if it's not working enough. Remember, patients with an arrhythmia or congestive heart failure, they are at risk for developing a blood clot. Um, and that's most likely what this blood thinner is being given for. So we want to make sure that they're having a blood test so that they're not having too little of the medication. And if they're having too little of the medication, then it's not reducing risk of blood clot. And if they're having too much, it's reducing the risk of blood clot, but it's increasing their risk of bleeding. So we need to make sure that the patient is showing up for their test, taking the test, and that we're giving some kind of review over those test results and check in with the patient. Also, a medical ID bracelet. All the patients should have this, but if the patient is taking blood thinners, maybe put some type of alert on the patient that says, hey, I'm at risk for bleeding or something like that. The physical assessment. So if there's trouble, where do we look? If there's a fire, there's going to be smoke in the sky, so we know where to look. But for our patient, we need to know specifically where to look. So I'm going to start off talking about congestive heart failure. What are the questions that we should be asking this patient when we're doing our assessment, or the questions we should be asking ourselves if something's not looking right with the patient? Weight loss or gain, we want to know about this. For this patient, this is important data. Blood pressure, of course, also standing, supine or sitting. Pulse, we want to know how strong it is. We want to know, is it regular? Heart sounds, murmurs, respiratory rate. One to note, and I should have highlighted this: coughing, wheezing, sputum color. This is a very specific assessment topic for patients suffering from congestive heart failure. Are they coughing or they're wheezing? Is there sputum? So are they spitting up anything? And what color is it? Because it's not uncommon for patients with congestive heart failure to develop a health condition where it causes them to actually spit blood or have blood tinged sputum. um, Breath sounds, and also are they having edema in their lower extremities, any swelling in the lower extremities, and the temperature. What is the temperature in the lower extremities? Because remember, patients with congestive heart failure, the heart isn't strong enough to pump. So we want to make sure that the heart is strong enough to circulate in a safe manner the patient's lowest extremities, or their fingertips or the tips of their toes. Okay. Coronary artery disease. What are we doing with this patient? Where do we look for the fire? Where do we look for the fire? Well, if you remember coronary artery disease, the patient is at risk for actually something called acute coronary syndrome. Now, why is this? Well, it's because a lack of oxygen to the heart. Remember, this patient has the narrowed blood vessels because of the plaque buildup. So, due to the lack of oxygen, because of the lack of blood that's flowing through those narrowed arteries, the patient may continue to complain of angina. And this clues us in that the patient may even be having a heart attack, or the heart monitor may show what may look like a heart attack. So this is called acute coronary syndrome. So it's just something else that we need to look out for when things aren't looking right. You can think, oh, this patient has coronary artery disease. I know that they're at risk for acute coronary syndrome and they're having unstable angina. So what else other than that can clue us in, or we should be doing in our care to help this patient? Well, we should be monitoring their blood pressure, heart rate, and respiration every 5 minutes if they have an angina attack. So if they're complaining of chest pain and it's really bad and the nurse is giving medication that's not working, we need to get in there and we need to just keep checking vital signs, keep checking vital signs, because we don't want that scenario to escalate into ACS, acute coronary syndrome, or it may already have, and we aren't sure yet because of the short duration of time that's passed. Also, we want to make sure we identify specific activities that this patient can engage in safely that are below the level at which angina pain occurs. So sometimes the patient's pain or angina pain occurs because of an activity or overexertion or when they're short of breath. So we want to make sure that we become acquainted or that the patient educates us about this level at which the angina pain begins. And we want to keep their activity right below that level so that we can work them out and slowly make improvements on their threshold, work them out more, but never go past it because we don't want to induce that pain for them that's very uncomfortable. Also, you want to make sure you reinforce to this patient, hey, if you're having angina pain, let me know. If you think something's going on with your chest, let me know. And also teach the patient relaxation techniques because sometimes they may get stressed out and they may bring the pain upon themselves just by stressing themselves out and worrying about things. So we want to teach them how to relax and how to, as a result, ease that pain. And last but not least would be an arrhythmia. So where should we look for the fire if the patient is having an arrhythmia? Well, first things first, we want to make sure we have a baseline of their heart rate according to the patient. We want to make sure we have a baseline for their skin, if they're on a blood thinner, for any bleeding or bruising that might occur. Same as our congestive heart failure patient, we want to know what activities make symptoms worse because this patient is also one of those patients whose heart rate and symptoms um, are very much attributed to the level of exertion and how hard the heart has to work to keep up if they're exercising. So we want to make sure we know this patient's threshold as well before engaging, helping them engage in physical activity. We want to check their blood pressure. This patient is very much at prone for dizziness, for falling. There are fall risk whenever their heart goes into an arrhythmia and electrical currents aren't flowing correctly. So moving this patient from sitting to standing or lying to sitting, we want to make sure we have some idea of where their blood pressure last was or where it is, or ask the patient if they're feeling dizzy. They can tell you better what's going on with themselves than any tool or assessment tool we have. And last but not least, pain or temperature changes in the extremities. And that's it, guys. That's it for today. That was a lot, but I feel like you guys are right there with me. I didn't lose you. Um, so let's test our knowledge. Let's just see how well you guys were able to keep up with the presentation, and what, more importantly, you were able to take away from today's presentation. So our first review question is: identify which of the following are the three key risk factors for heart disease affecting most of Americans today. And I want you to select all that apply because I have five choices and only three answer choices of the five are correct. So which three are the key risk factors for heart disease? So I'm gonna give you a moment now. Okay, you should have the answer by now. And if you chose A, C, and E, you are correct. Smoking, high blood pressure, and high cholesterol. This was the three key risk factors I talked about on one of our earlier slides. And I also tried to mention it at least once or twice throughout the presentation that smoking, high blood pressure, and high cholesterol are the three biggest risk factors for heart disease that most Americans are struggling to treat. So If you got this question right, congratulations. If you didn't, you got one more chance. Let's see what you got. So, in question number 2, an obese patient with diabetes and AFib controlled with a blood thinner is preparing to eat dinner. So a patient is obese, diabetes, and AFib, taking a blood thinner for the AFib to prevent blood clots, is preparing to eat dinner. While assisting the patient set up their meal, you notice which of the following items is not appropriate for them. So which patient with AFib taking a blood thinner, which meal item is not appropriate? Is it herbal tea? Is it small green salad? Is it steamed carrots? Or is it a chocolate chip cookie? All that sounds good. But one, this patient should not have. Let's see how good you guys are paying attention. This is a little more difficult of a question. All right. Give you guys another 15, 30 seconds here. All right. And the correct answer is herbal tea. Herbal tea. I know you got that right. So let's talk about it. Herbal tea. Uh, small green salad, steamed carrots, chocolate chip cookie. So this patient has diabetes. Um, they probably shouldn't be having chocolate chip cookie, but if they're following the DASH diet, remember we talked about how the patient can have a few servings of sweets every week. So a chocolate chip cookie, while that isn't the best choice for this patient, among the other items, there's one, as you see, herbal tea should definitely not be there. Steamed carrots, that's a healthy item. There's no problem with that. Small green salad. Now, this is the answer choice that you may have selected. A small green salad, because it's a leafy green, contains vitamin K. But again, we talked about herbal tea is the correct answer choice because of the caffeine, and it is uh, also has vitamin K. So herbal tea just has more caffeine than a small green salad. And we talked about how patients with AFib should not have caffeine, and patients on blood thinners should not have vitamin K, which is in leafy greens and herbal tea. Mm. All right. So, as promised, here's our course review again, just to talk about the main topics we touched on today. If you recall at the beginning of the presentation, I said you should be able to define heart disease and discuss its impact on health in the United States. We talked about its impact, some on the cost, and also in relation to heart attacks and how many heart attacks they're having in the US. And you should definitely be able to define heart disease today. And if you can't, then you at least are aware of its impact on the US, and that heart disease is just an umbrella term for 3 types of diseases. And those diseases we talked about in Objective 2: coronary artery disease, arrhythmia, and congestive heart failure. And we also talked about the signs and symptoms specific to each one. Moving along to our third item on our course today was to understand risk factors associated with each type of heart disease and appropriate preventative measures to reduce the risk. Now, this we talked about each associated risk, and we talked about preventative measures, which was kind of consistent across each of the 3 diseases. Moving along, item 4, discuss common medications patients with heart disease may be prescribed, their side effects, and nursing considerations. We talked about for patients with coronary artery disease, they may be taking nitroglycerin, and patients with arrhythmia and congestive heart failure, they may be taking some type of blood thinner. And we talked about the nursing considerations and the side effects for those 2 medications specifically, especially blood thinners in detail. And last, we talked about key elements of the physical assessment specific to each type of heart disease and the abnormal findings that may indicate a medical emergency. So that concludes all the information today. I hope that you can use this information to help improve the care that you perform at the facility where you work and improve the life and well-beings of the patients at that facility as well. I want to thank you again for joining me today for the last past hour. It's been great. My name again is Deontay J. Marquis. I'm a family nurse practitioner and Bachelor of Nursing uh, in Southern California. And this presentation comes provided to you by my ALF Training. And I can't wait to see you guys next time. Where I'll have another topic and we'll spend an hour together discussing that topic. Have a good one.